AI bias and ethics failures. Oh no, say it isn't so. Sadly, my friend, it's true. If something sounds too good to be true, it possibly is. First example, algorithm bias, the dark side of Google Ads targeting system. Google's ad targeting algorithm had proposed higher paying executive jobs, more for men than women. Secondly, second example, Amazon had to scrap an internal recruiting tool that showed bias against women. Amazon used an AI application to conduct interviews and score prospective employee openness and to what extent they were extroverts. And the AI tool was later tested with a female actor who spoke and delivered the script to see how well the application would score her. Turns out, however, when the female actor wore glasses during the interview, it influenced the AI score, resulting in a lower score. When the female actor wore a headscarf, as many Muslim women do, it further influenced and lowered the AI assessed interview score. Third example, one algorithm tried to maximize a marketing budget by getting as many eyes as possible on an ad. Women, it turns out, were likely to spend, or rather are likely to spend, more money on the internet, thereby making the ads bias. So it's therefore more expensive to show women an ad than to show someone similar to a woman an ad. Fourth example, the Science Journal identified and wrote about dissecting racial bias in an algorithm used to manage the health of populations. And the AI identified patients for managed health care, but the AI model was programmed to find the sickest people among them and assign health care to them. Interestingly, however, the sickest was defined and determined by how much they spend on health care. More evidence and another indicator of the American medical industry being profit driven to monetize the moment rather than to help and heal patients. So much for the Hippocratic oath to do no harm. So instead of predicting how sick the patient was, instead the AI model predicted the amount of spending that would occur when selecting a particular patient. Now the patients with the highest predicted spending therefore were assigned to managed care by the AI model, the biased AI model. So what influences healthcare spending? Well, employment, income, family support, and access to the healthcare system itself. Thus, a racial bias was detected when the healthcare algorithm was used, since white patients' healthcare costs were higher compared to equally sick black patients. And if you don't know how the system works, let me tell you. If you walk into emergency rooms, typically, or any clinic, they will see if you have insurance or not, or cash or credit cards or a means of payment. If you do not, and you're paying out of pocket, if you're paying cash, typically the cost in the fees are lower. If an insurance company's covering you and paying for it, they bill them typically higher. And that's a whole backdoor negotiation process later on. If the insurance company chooses to reject the amount that they were charged, and they renegotiate the amounts that they should be billed for particular services from any given clinic or hospital. So insurance companies are billed at a higher rate than a typical person or patient paying out of pocket. Therefore, those who have health insurance typically will be found to be bigger spenders on health care, another means of bias. So, fifth concern, beyond what influences spending and how these AI algorithms are created, a fifth concern is our personal internet footprint, and therefore what we are shown, it differs because our internet footprint and what we search online and view and enjoy, we all have different preferences, and therefore the beloved cookies on your computer or your device tracing your internet use and search history are unfortunately often being sold to companies and monetized and made accessible, whereby even AI models themselves can somewhat see your personal preferences and thereby adjust the data that they show you and outcomes they predetermine for you and thereby lead you toward. So this is a small part of the good, bad, and ugly of artificial intelligence, the internal biases therein, and some of the inaccuracies that are inherent within AI models that need to be further monitored and governed by humans to make them more responsible, equitable, and ethical. And what we commonly know and call AI today has not fully arrived. There needs to be more improvements and innovation and human moderation to ensure equitable use and fairness and responsibility to uphold the integrity of these technologies and also to protect humanity.